Assalamu alaikum. আমি Dr. Farjana Khanam, Assistant Professor, Anatomy Department. Today our topics is the connective tissue. It is a histological topics. One of the basic tissue is the connective tissue. The other tissue are epithelial tissue, muscular tissue and nervous tissue. And in our body, the component of the connective tissue is much more than the other tissue. Now, in these topics, we want to learn about the definition, component, ground substance, types of fiber, types of connective tissue cells, function and disease of connective tissue. So, the connective tissue is the component of the connective tissue is the major component is the extracellular matrices and the other component are the cell and the fiber. So, what is extracellular matrix? The extracellular matrices are the component of the fiber, that is protein fiber, collagen fiber, reticular fiber, elastic fiber, and is the ground substance. Ground substance is the component or mixture of proteoaminoglycan, glycosaminoglycan, glycoprotein or proteoglycan. These are the supporting structure. A water of the ground substance act as a metabolic media for the supporting. So, what is the function of connective tissue? The function of connective tissue is to maintain the supporting structure and to connect the tissue with one another to make an organ, and it is a very important medium for the metabolic support. In this picture, the tissue that connect and support the different part of the body is called the connective tissue. Now, let's come to our next point. What is the component of the connective tissue? Connective tissue composed of fibers, cells and intercellular ground substance. In fiber, the name of the fiber is the collagen fiber, reticular fiber and elastic fiber. In examination, usually in Viva, it is asked that what are the name of the fiber of the connective tissue. So, name of the fiber, I repeat that it is a collagen fiber, reticular fiber and elastic fiber. Now, come to the point of the cell. What are the cells present in the connective tissue? There are two types of cell present in the connective tissue. Some are permanent, some are not permanent or transient cell. The permanent cell, that means which reside in the connective tissue, do not migrate from the site. So, what are the permanent cell? These are one of the important are the fibroblast cell, undifferentiated mesenchymal cell, pigment cell and adipocyte. I repeat again, the intrinsic cell or the permanent cell are fibroblast, undifferentiated cell, pigment cell and adipocyte. And in migrating cell or transient cell are the macrophage, mast cell, lymphocyte, plasma cell, monocyte and eosinophil. And the other component is the intercellular ground substance. In this picture, let's show about what are we see in this picture. In this picture, there is a schematic diagram of a connective tissue. For this, here we see the fiber, cell and ground substance. In cell, we see the fibroblast, adipocyte, macrophage and mesenchymal cell. And in extracellular matrices, which are composed of fiber and ground substance, in fiber we see the most thick fiber is the collagen fiber, then the reticular fiber and the thin is the elastic fiber. And in between cell and fiber, the whitish component is the ground substance. Some blood vessels are also seen. This is a picture of fibroblast, which is an important and permanent cell of the connective tissue, that is called fibroblast. So the shape of the fibroblast is stellate or star shaped, centrally placed nucleus, and the major function of the fibroblast to secrete and synthesis of the ground substance and the fiber. আবারও বলছি আমরা, the main and important function of the fibroblast is to synthesize and secrete the ground substance and the fiber, that is the composed of connective tissue. There is also a picture in where we quite seen the different composition of the connective tissue. In this picture, there is a large blood vessel, then we see the three fiber. Again we see collagen fiber, reticular fiber and elastic fiber. In the cell component, we see the fibroblast, plasma cell, macrophage, eosinophil, lymphocyte, mast cell, adipocyte, and in between cell and fiber, the whitish component is the ground substance. Now, let us come to the classification of the connective tissue. What is the classification? On the basis of the combination of fiber, cell and ground substance, the connective tissue is classified into 3 sections. Number 1, connective tissue proper, number 2, embryonic connective tissue, and number 3, specialized connective tissue. This is an important classification for all of the students because it is used in many area both in the skeleton, in gross anatomy, and also in histology. Now come to the point, what is connective tissue proper, or what are the component of the connective tissue proper? In connective tissue proper, there is 3 component, that is loose areolar connective tissue, dense regular connective tissue, and dense irregular connective tissue. এখান থেকে আমাদের পড়তে হবে what are the characteristics of this connective tissue and what is the location and why we need this connective tissue, or what is the importance of this connective tissue. So we want to know about the characteristics of this connective tissue, location of this connective tissue, and why we need this connective tissue. First one is the loose connective tissue. The term loose means areolar. So in the loose connective tissue, there is much more ground substance than the fiber and then the cell. So its major function is supporting microvasculature, nerve, and immune defense. That is, lamina propria beneath the epithelial lining of the digestive tract is one of the important example of the loose connective tissue. Loose connective tissue মানে এখানে ফাইবার এবং সেলের চেয়ে গ্রাউন্ড সাবস্টেন্সের পরিমাণটা বেশি থাকবে এবং এতে কি ফাংশন করবে, এটা হচ্ছে মাইক্রোভাস্কুলাচার, নার্ভ এবং ইমিউন যে সেলগুলো আছে সেগুলোকে সাপোর্ট দিবে. হোয়াট ইজ দ্য এক্সাম্পল ওভার হোয়ার ইট লাইস জাস্ট ল্যামিনা প্রোপ্রিয়া বিনিথ দ্য epithelial or lining epithelium of the digestive tract. Second one, dense irregular connective tissue. In this term, what we find, number 1 dense, number 2 irregular. Dense means the consistency of the fiber, it means where it is dense. Regular or irregular means the direction of the fiber. If all the fiber directed in same direction, then it makes it a regular. If the fiber are interwoven and randomly directed, then it forms the irregular. So dense irregular connective tissue, it has a little ground substance, few cells, but much more fiber which are randomly directed. What is the function of this classification or this classified? It protect and support the organ, resistance the tearing. It means it helps or protect from tearing. So what is the example? That is the dermis of the skin, capsules of different organ, submucosal layer of the digestive tract. That is the dense irregular connective tissue. Now come to our third point, dense regular connective tissue. It is almost completely filled with the fiber parallel to the cells and little ground substance. That means the collagen fiber are aligned in parallel direction aligned with the fibroblast. That means the direction of the fibroblast are parallel. কোলাজেন বা যে ফাইবারটা থাকবে সেটা একই ডিরেকশনে যাবে. So what it function? It provides strong connection within the musculoskeletal system and strong resistance for the force. So what are the example? These are the important because it lies in the skeleton, ligament, tendon, aponeurosis and corneal stroma. So আমরা কানেকটিভ টিস্যু প্রপারের মধ্যে 3টা ক্লাসিফিকেশন পড়লাম: লুজ অ্যারিওলার টিস্যু, ডেন্স ইররেগুলার কানেকটিভ টিস্যু, ডেন্স রেগুলার কানেকটিভ টিস্যু. Now come to the point is the embryonic connective tissue. In embryonic connective tissue there is the mesenchyme and mucoid connective tissue. Mesenchyme means in early embryo, that is the middle layer of the embryo is called mesoderm. The cells are undifferentiated. That means it can differentiate to any type of the cell is called the undifferentiated mesenchymal cell. And the location is the mesodermal layer of the early embryo. Number 2, mucoid connective tissue, randomly fibroblast and collagen fiber present, that is the matrix of the fetal umbilical cord. Mucoid tissue is only found in the matrix of the fetal umbilical tissue. Second one is connective specialized connective tissue. Second one is the specialized connective tissue, that is called bones, cartilage, blood and reticular fiber. Bones is a specialized connective tissue because it is found hard in structure. Cartilage is also specialized connective tissue because it is also semi-hard or semi-hard or transparent structure. Blood, it is a liquid form of the structure, and reticular fiber, these are the supporting structure. So these are the classification of connective tissue. This is very important. আমি আবারও বলছি, এই কানেকটিভ টিস্যু ক্লাসিফিকেশনটা বারবার করতে হবে, এটা গ্রস অ্যানাটমিতে ধরবে এবং হিস্টোলজিতেও ধরবে। নাও কাম টু আওয়ার নেক্সট পয়েন্ট, দ্যাট ইজ দ্য fiber of the connective tissue. The fiber of the connective tissue are classified into three. Number 1, collagen fiber. Number 2, reticular fiber. Number 3, elastic fiber. The most important and the most abundant fiber in the connective tissue is the collagen fiber. Collagen fiber is synthesized and secreted by the fibroblast cell, and it is the supporting structure of our body. So collagen fiber are classified into 3 classification, that is fibril forming, anchoring forming and network forming. So in this lecture we have completed about this. The further lecture or further information will be given in the next lecture. Thank you.